Good afternoon. My name is Anna Valle, and I will be exploring tobacco prevention policies and how that could benefit the health of our local communities at the local, state, and federal level. So, I want to start off by discussing the prevalence of tobacco use and its harmful effects on health. So, in recent decades, the use of tobacco has been in decline. However, it continues to be the leading cause of preventable disease and death in the United States. Approximately 18.7% of Americans use tobacco products, with the leading one being cigarettes. Um, those who are more likely to use tobacco products are those individuals who may identify as LGBT, live in rural areas, or individuals who maybe have less access to healthcare, such as those who are uninsured or who are on Medicaid. And some of the harmful effects of tobacco use is that it causes 80% of lung cancers and can lead to additional health complications such as emphysema, chronic bronchitis, and COPD. So, I really wanted to discuss the Family Smoking Prevention and Tobacco Control Act, also just known as the Tobacco Control Act. And I want to start off by mentioning the tobacco product standard. So currently, the Food and Drug Administration, also known as the FDA, has the authority to set tobacco product standards to protect public health. Some of these can include, such as eliminating the sale of flavored tobacco products. Um, so I know one of them that is currently being discussed is to ban the sale of menthol. That's one of the products that's still in debate, but some other products, flavors that we can think about is those who are more likely to be marketed to adolescents or young adults, such as like strawberry, coffee flavored, things of that nature. In addition, they can also eliminate the use of certain ingredients. So, one of them that we can talk about could be like pesticides and kind of how much of that can be in these types of products, which is already really harmful for our health. Um, and something that is kind of also in the works is limiting how much nicotine can be in combustible products to really reduce the risk of addiction. And in addition, I want to talk about how we can regulate the tobacco products that are sold and distributed. One of those being that the age has been raised formally 18 to 21 to buy tobacco products. Um, Also, they raised the age of when you should check for ID. So, for example, I think before it was about 27, and now they raised it up to 30. Um, they aren't allowed to sell tobacco products in vending machines, and also they're not allowed to distribute products, either free products. And so, some things that we can think about is at the legislative level, how we can, write laws that really limit the nicotine levels that are in tobacco products, banning menthol, and also imposing greater repercussions for those who sell to underage youth. In the executive branch, prioritizing tobacco use as a major public health concern, updating regulations to reduce the marketability of tobacco products to toward youth, and then also with the judicial branch, reducing the likelihood of tobacco companies and retailers using loopholes when attempting to distribute these products. And finally, for the best approach, I really think that it should be done at the federal level, as the FDA already has the authority to regulate this product. However, the state and local governments can further support the legislation through limiting where tobacco products are sold, such as being away from schools, promoting smoke free environments, such as through restricting multi unit housing like smoking, and then also making tobacco products less affordable through increase in taxes.